In the 1940s, about 70 years ago, there was a clinical test done on human beings that was very disturbing. Jaslow from CBS News in 2011 states that human beings were deliberately injected with syphilis and sexually transmitted diseases during this experiment. If this was done in the present time, we might call this torture, unethical treatment, or just plain disgusting. But back then, it was seen as science, according to Jaslow in 2011. The one that can take full credit for this experiment goes by the name Dr. John C. Cutler, according to Jaslow in 2011. In Guatemala in the 1940s, Dr. John C. Cutler had U.S. researchers inject prostitutes, soldiers, prisoners, and the mentally ill with potentially lethal STDs, stated Jaslow in 2011. The reason the injections were being done was to see if the drug penicillin could prevent infection, said Jaslow in 2011. There was a total of 1,300 people purposely injected. Of these 1,300 people, only 700 were cured and 83 died, said Jaslow in 2011. These people were not just injected with some form of infection. They encountered excruciating pain and discomfort throughout the process. According to Jaslow in 2011, patients were injected with syphilis, gonorrhea, or chancroid, not in just a standard place such as the arm. Some were injected in the eyes and back of the skull. The commission's head, Dr. Amy Gutman, involved a female syphilis patient who had an unrelated terminal illness. Researchers were curious to see what impact an additional infection would have, so they infected her with gonorrhea in her eyes and elsewhere, says Jaslow in 2011. Jaslow states in 2011 that she died 6 months later. There were said to be 10 American doctors and 12 Guatemalan doctors involved in the study, injecting patients without their consent, says Fox News in 2011. Unethical clinical testing was and still is a huge issue in the society today. Although clinical tests have progressively improved, bringing back memories of just how awful these experiments were will hopefully remind us, and experimenters, to take all the precautions we can in order to stray away from performing an unethical test on innocent human beings. For more information, visit www.reuters.com or www.nytimes.com.